So what happened was that Brigetta called me and said that this bonobo experienced some type of an injury, and they could tell that there was a loose tooth, and they really couldn't tell whether it was fractured, whether it was a complete fracture, whether it was actually a fracture of the tooth itself or the supporting structures of the maxilla. Once he was anesthetized, it was pretty evident that it was a maxillary fracture. It was actually a fracture of the anterior quadrant, right quadrant of his maxilla. And the teeth were completely intact, but it did the fracture encompassed both the canine tooth and the second incisor. Initially, we weren't sure whether it would involve, the procedure would involve just extracting the tooth or what. And in this case, because there's such a large area of bone that was fractured, what I elected to do was to try and treat that as any other fracture by trying to immobilize the bone. And so what the procedure essentially involved was just cleaning and prepping the teeth in the area, cleaning the fracture site, debriding the fracture site to regenerate a good blood supply, because that's going to assist in healing. And so essentially, just by applying basic principles of fracture repair in reducing the fracture, getting the bones in a normal relationship, and then stabilizing the fracture. In this case, when we're dealing with jaw fractures, they tend to be a little more complicated just because the bone is so irregularly shaped. With a fracture of a long bone, it's easier to apply either an internal plate or a pin, or even put a cast on the fracture. But in the oral cavity, again, because the bone is so irregular, you have to improvise to some extent. So what this involved essentially was using some orthopedic wire and passing some wire around the adjacent teeth that are stable, that weren't involved in the fracture, and use that as more or less a scaffolding, and then applying a very mild phosphoric acid etching to the enamel to roughen the surface, and then apply a dental acrylic material, which eventually hardens to create a splint. Then once the acrylic is cured, it's smoothed, and so in a primate's case, the difficulty may come in where because he has opposable hands, he can potentially pick at that, and so by smoothing the surface out and just making it as comfortable as possible, hopefully he won't object to it very much and leave it alone. So if we can leave that stabilization in place for a good 8-week period, it should heal just fine, and he may have to undergo another very short-acting sedation just to remove the splint, but he should do fine with the injury. If the fracture is stable enough and strong enough, he should be able to eat what he wants to eat. He has to be careful about not traumatizing the area again, so I believe he originally injured that by playing or interacting with another bonobo, so we want to avoid that type of situation if at all possible. No more roughhousing, right, no horseplay, yeah. You know, I think he should do great. I think he has a really good prognosis.